Well, hi, we're on Facebook Live again. This is Dr. Silber, Dr. Sherman Silber, Infertility Center, St. Louis, and we really have a treat for you tonight. I'd like you to meet the Furnos. I don't even know if I'm pronouncing it right, but that wasn't your name when we first made you. I mean, she was a product of assisted reproductive technology. Was this, I guess, 35 years ago?
Yep.
And and her mother referred her to us because now she needed assisted reproductive technology. So we have like two generations of IVF. But
Yep.
in the era when we took care of our mom and dad, we weren't doing that good at IVF. We were doing gift because we had a higher success rate. So I shouldn't be doing any more talking. Why don't you, or I can ask you questions, but
Yeah.
look at, I mean, your little girl is taking, she's upstaging everyone.
I know. She tends to do that. She's a talker. She's 9 months just a couple days ago. So.
Oh my gosh, and she's talking already. What a girl. So I'll ask you simple questions. So how long had you been trying to have a baby, and when did your mother dare to intervene and tell you where to go?
So we had been trying for 7 years. I was undiagnosed with endometriosis for quite some time, and we lived down in Arkansas, and we were trying for basically since before our marriage, really, and we were not having any success. I had multiple laparoscopic surgeries once we did diagnose the endometriosis, and those did not help. We went through multiple rounds of Clomid, multiple rounds of letrozole, and those were also to no avail, to which our doctor then said that we would need to seek out assisted reproductive help, essentially. And we went and we talked to the team in Arkansas. There's only one clinic in Arkansas who does anything with fertility. So we went to them, and we just were not entirely pleased with our first introduction there and what their plans were for us. It didn't feel like we were really heard. It didn't feel like our past was really looked at in terms of what they were going to do for our plans moving forward. And when we left that appointment pretty disappointed, to say the least.
You must have been very, very sad about all that. Because
what?
Get answers, and they weren't listening. Yeah, okay.
Yeah, it was hard, and I really tried to advocate for myself. I did a lot of research, knowing that, of course our dog is barking, knowing that...
it's a big family, a dog too.
Yeah, 3. But knowing that I had endometriosis, I had done quite a bit of research, and they wanted to put me through multiple rounds of IUIs, and we knew with my stage of endometriosis, it just was going to be really difficult at that point in time. So that was when my mom said, I think Dr. Silber is still practicing. You should give him a call. And
your mom was wondering if I was still alive, maybe.
Yeah, she said, she's like, I feel like I just saw something on him recently that he's still practicing. So give him a call. And we literally did the next day.
Busy as ever. And I plan to help you have another baby too. So
hopefully.
Yeah.
We love her so much. It would be great to have another.
Fantastic. Well, usually when parents intervene on something, that's the kiss of death. You'll do the opposite of whatever they tell you to do. You listen to your mom. But did you realize you came from our clinic and that's how you were made?
Oh, yeah. I have known that since I feel like the dawn of time. My parents have always talked to me about that. There were actually some children that I grew up knowing that were also a product of your clinic as well. They were triplets. And I remember, if I recall correctly, they used to do meetups of the children that were a product of you. And the parents would get together and bring all the kids together. And that was, I grew up knowing that from the moment I could understand what it was. So,
we try to avoid triplets. Occasionally it might happen, but it's fantastic modern medicine, the way these triplets, that normally the whole pregnancy would be lost. but the way they can manage them, and they do really well. But
Mhm.
but we try to avoid triplets, and yet I remember that case. I mean, it was right around the same time. But in
Mhm.
those days, we're talking 35 years ago. I mean, we'd be transferring 4 eggs at a time.
Yeah.
Now
Mhm.
now we're beyond that phase. Well, it's the the first treatments that you were given, I think I would say this to everyone who's listening in, it's a very bad idea to start with these simple treatments because they don't work, their success rate is low, and it's fine if you're 22 years old and have all the time in the world. But if you're approaching 35 and you're going through IUIs, which have an extremely low success rate, especially with your massive endometriosis, all they're doing is allowing your eggs to get older, which will give us a lower success rate with IVF. So
Mhm.
I think it's a very important concept not to be stuck in that mold of just automatically going through IUIs or other unnecessary diagnostic procedures all the time, allowing the eggs to get older.
Yeah, we were so grateful for that. I mean, I'm pretty type A, and I did a lot of research going into this, knowing that we were going to need some, additional help other than IUI, and I knew about the eggs and how they age and how much you lose as you get older and what that time frame looks like. And I just was like, we've got to do something now. And I was just so grateful when I called you and you all felt the same way. It was just a really big blessing. And
So when you went to the Arkansas clinic, you felt maybe you knew more than they knew.
oh yeah, I felt when they said that they were going to put me through at least 3 rounds of IUIs, I felt in my heart, I was like, they're just throwing add-ons in the checkout line, just because I felt like that was not going to be successful. That there was just something in me that told me that we needed to really just kind of go for it and go, all the way. And when we called you, you felt the same way. So it was just really nice to feel heard and feel seen in that
I
way.
mean, we didn't want to wait till your eggs got older and the results wouldn't be quite as good.
Yeah.
Although we see women in their 40s and we have reasonable results with them, but it doesn't compare with under age 35.
Mhm. Yeah, we're really lucky we got in right in time.
Fantastic. So I really don't want to push you, but I want to ask you how's your mom? I don't know anything. I haven't talked to them.
They're wonderful. They live down in Florida now, and they came and spent some time with baby Zuzu shortly after she was born, and they've been here for some holidays, and they love being grandparents. Of course, it was just kind of when we found out we were having a girl, it just felt surreal, but it also felt so right. It
Well,
was
there's no question in my mind that girls are better. I mean,
yeah, I mean, I couldn't have pictured myself. Like I tried to picture myself with a boy, but I just had this feeling that she was going to be a girl. And I think my mom is loving every minute of being a girl grandma as well. And so is my dad. So
actually, I had 3 boys, and boys are okay. But there's an old statement that your son is your son till he finds his wife, and your daughter's your daughter for the rest of your life.
yes. That's a wonderful way of
And my
putting
other
it.
3 sons are all over the world, and we're nowhere near them. And that's great. That's what we raised them to be. But something about having a daughter. So now we have 6 granddaughters.
Oh, wow.
So special.
That is so special. They really, I mean, now I get it when they say the immense amount of love that you have when your baby is born, and I feel that now. But I also never directly was able to see the whole grandparent connection, love, like immediately. And between my parents and my husband's parents, I think there's enough love for her to just fill up multiple cups. So.
So talking about your husband, how did you guys wind up in Arkansas? You don't have an Arkansas is beautiful. I love the state. You have an Arkansas accent. So is your husband from
So,
Arkansas?
no, actually, both of us are not from Arkansas. So I am from St. Louis. I grew up in St. Louis.
Yeah, I know you grew up in St. Louis.
Yeah.
You were born in St. Louis.
Yep. So I was born and raised there. I went to school at Missouri, and when I graduated school, I took a job with a company's corporate office down here in Arkansas, and my husband actually moved in right next door to me, like 2 weeks later, and here we are. And he's from.
You were the girl next door.
Yeah, it was literally the girl next door, and he's from Iowa originally, and moved down here. His parents, his dad was a railroader, and moved down here to kind of follow his family, and opened up a restaurant. So he's a chef and restaurateur, and owned a really fancy restaurant when I met him. So it was real easy to, hey, feed me, and I'm happy. So.
Well, yeah, actually, Arkansas, it's a beautiful state, and I like to fish, and I'm planning on going to Argentina finally to fish for the big brown trout. But what I understand is, if you want really bigger brown trout, you go to Arkansas.
Probably, yeah. The fishing is great down here.
It's supposed to be fantastic fishing in Arkansas, and I haven't tried it yet.
I used to go trout fishing all the time with my family up in like very, very southern Missouri. And now we can just go a couple hours north, and we can go trout fishing with what they call a Carolina rig, which is, it's just a little piece of corn and a marshmallow, and you can catch rainbow trout all day.
With a little piece of corn, that's it?
Corn and marshmallow on a hook, and that's it.
I'm always trying to match the hatch, and it's very complicated. Yeah. You have these days where none of them are interested. They're too educated. And you're telling me put a little piece of corn on and you'll catch big rainbows.
Yeah.
You didn't want a big.
Okay. So I'm going to be a little pushy here. I want you to invite me to Arkansas, because I'm not going to get there unless
you always have an open invitation with us. You have. She's the greatest blessing we could have ever asked for in our entire lives. She's changed our lives for the better, and I get emotional about it, but we wouldn't have her if it weren't for you. So you always have an open invitation here. We've got a room upstairs.
That's fantastic, really. I was there once at the medical center, which is really a very good medical center.
Mm-hmm.
I had a chance to visit it, and I think Arkansas is supported by the prosperity of Walmart and Dyson, and I mean it's a prosperous state actually, and I know there's a lot in the medical center.
Mm-hmm. And Northwest Arkansas is very progressive. I mean, there is a lot, because of Walmart being up there. There is a lot going on there. There's more than meets the eye down here.
Exactly right. So why don't you tell everyone how easy, we did a mini IVF protocol with you, but minimal stimulation. You want to tell everybody how easy, or be honest, if it was difficult for you, miserable, tell us that. Tell us what it was like.
I mean, obviously, it's never easy when you have to like inject yourself with a needle. And that was my biggest fear. And of course, my anxiety doesn't make anything any better, because I have very high anxiety, and the stress of just, will it be successful? That's hard. But I have to admit that your team did a fantastic job, not only keeping me organized with all of my medications, all of my calendar, the schedule of everything, organizing everything in terms of us being out of state, especially. Like, they made it so easy for us to plan around when we needed to be in St. Louis. So that was a huge help. And not only that, but given the fact that I have crazy anxiety, I think I called about everything, every little twinge, every little feeling, every little concern, or, oh my gosh, I might have done too much of this medication or too little of this one, and I don't know what to do. And I called them at every moment, and they were always there to answer immediately. Even sometimes emails they would send after hours, just to make me calm and to let me know that everything was going to be okay. And
they are absolutely fantastic. I think that is one of the great secrets to our success. We have just an amazing staff of nurses and coordinators. They're absolutely spectacular. You know what I tell every patient now, every new patient when I see them, when the consult's over, I say, you can call us every day with more questions, or you can call us 10 times a day. Or if you have a panic attack at 3 a.m, you can call us at 3 a.m.
Yeah.
And I mean that. And that's,
I mean, it rings true. You guys were available every step of the way. And I think right before my egg retrieval, I even had a ruptured ovarian cyst a month before. And I was so nervous that was going to screw everything up. And rest assured, your team was fantastic in assuring me that we were going to still move forward with everything. And it was just wonderful. And on top of all of that, I think that the other big thing that I can say was a huge help during the whole process with y'all was just having the amazing support of my husband. I mean, it really takes a team to kind of go through this. It's a heavy thing, you've got to do medications and you're probably not nice all the time because of all of the hormones and emotions that are running through your veins. And, he was the best teammate I could have asked for. So shout out to the man holding the baby right now.
I agree with that. He's a very nice guy. But did you throw dishes at him or physically harm him?
I don't think I physically harmed him. I'm not sure I threw any dishes, but I definitely threw attitude. So he dealt with that very, very well. But it was, again, in the end, worth every prick, worth every piece of, with every pill and medication I took to get us where we are today. And for that, I'm super thankful. And for your team, I'm super thankful because it is not an easy process. But when you have a village behind you helping you push in the right direction, it's absolutely.
I want to tell everybody out there who may be listening in Facebook land that we did not prompt Megan to say this. Spontaneous, no prompting whatsoever.
I will shout it from the rooftops. I will be your testimonial for all of time. Believe me, I am very, very big on spreading the word to your clinic. I've sent friends to your clinic. I know people that have gone through procedures at your clinic. So it is my joy to be able to hopefully be able to spread the joy that we have with our family just through working with you. So
I never could have imagined when you were just a little egg. I mean, you were an invisible little egg. You were going to grow up to such a wonderful person. I mean, I think probably your parents get great credit for
that. They do, yeah. I think everyone around me. I love. My parents get credit. I think my husband gets credit for growing with me during the hard years. I'm really thankful again for just the people that I've had around me to get me to where I am now. I wouldn't be here if it weren't for them, and I wouldn't have been at your clinic if it weren't for my parents saying, go there. I wouldn't be here if it weren't for them. So.
Oh, they're great people. And, I wanted to make another point that's interesting, that I find that I like to follow these children until they're grown up. And I find that the children of patients that had to go through IVF or gift or whatever, they tend to be so competent and so emotionally stable and so put together and so charming. And I have a theory that I think it's because the parents wanted them so badly, went through so much, and your mother went through more than you went through, by the way, because in those days it was surgery. They went through so much to have the baby that they really are having a great relationship, and that first 3 years of life is crucial.
Yeah. I always say I will never compare the love that I have for someone who conceived for my child, for someone who conceived naturally with their child. But I will say that it has given me an entirely different perspective just in how hard we have fought for her with every little thing that I do. While I was pregnant with her, every little piece that I put into my body, my husband, we researched the best food that I could possibly be eating. And he's a chef. So he was making all of the things and doing all of the stuff. I mean, I had terrible endometriosis and we went through a special diet for that. We rebuilt my red blood cells and I just made sure everything that I did, I was doing the best that I could possibly do for her. And still to this day, I'm nursing and we're 9 months in and I still make sure that I am just filling my body with the best nutrients to make sure that I'm doing that for her too. And I think it'll continue for forever.
You're verifying what I was thinking and saying. It was certainly true with your parents and true with you and your husband. is that special interaction that
Mhm.
you're describing with that baby in the early years makes for a competent, charming, and morally good person. That's where it all comes from. So
I hope so. I hope that she's just as wonderful to everyone else as we already believe she is. So,
it's fantastic. So I don't know. I'm wondering if we should open this up to some questions. Is anybody out there? Tony's our moderator. Anybody out there that wants to ask Megan anything or me anything? Because I think we have about 10 more minutes available. Any questions, Tony?
So
Not hearing. Oh, we lost him. I'm sure you're hearing us. We're not hearing you, Tony.
here,
I'm trying to look at. There he is.
Tony, you're mixing me up.
okay, yeah. So, Dr. Silber, we have a few questions here, or not really questions, but comments. So, here's some testimonials. Dr. Silber is the best. Our twins are 11 now.
Yes,
Here's one from Lauren. It's got to be true. Megan's one of the most wonderful people I know. And then here's another one. She is so cute.
fantastic.
Baby Z is a gourmet baby, not a Gerber baby. Here's one from Deanna. Dr. Silber helped us having our daughters. And let's see, here's another one. I'm currently pregnant with twin girls, thanks to Dr. Silber.
Oh, that's wonderful. I love the heart.
My baby is 25.
Oh, well, still younger than Megan. I don't want to reveal your age exactly, Megan, but you've got to
Here's
work.
another one. My daughter is 24. So yeah, there people are. Yeah. Oh, here's actually a question. Does the success rate increase if the first transfer failed?
Success rate is really always the same. So if we have a 60% success rate per embryo transfer, which is what we usually would have, every time we do a transfer of another frozen embryo, it's going to be the same. It averages out. Now, actually, Megan's a good example because the first transfer, she didn't get pregnant. That could be a moment of great depression and fear that it's all for naught. But I told her, and I always tell them, it's the same every time we do a transfer. So if we do another transfer, it's going to be 60%. No, it doesn't increase, it doesn't decrease.
Okay, yeah, that's pretty much in terms of questions. Pretty much, I put up all the testimonials there, and also all the people that had babies with your clinic. There. Let's see if there's any more comments here. Okay, yeah. So no more questions at this point. So yeah, we still have about another 7 or 8 minutes left to go here too. So, Dr. Silber, perhaps one of the most asked questions is, what is the difference between IVF and mini IVF?
Well, that's a good question, and I'll try to be simple about it. Now, there are two hormones that we use to stimulate, FSH and LH. FSH only is going to recruit follicles. That's all it does. Really doesn't have anything to do with egg quality. It's just recruiting follicles. LH, in a very, very small amount, is necessary for egg quality, even in the beginning part of the stimulation. So you don't want to use too much FSH. And what we found is with low dose FSH, we're getting just as many eggs as if we pounded the patient with huge doses that made her miserable. And the baby rate per egg is actually four to 5 times higher at any given age than with maximum we call COH. Paper that we published, but normally the baby rate per egg, Pasquale Patrizio, Dr. Patrizio in Florida was the first one to actually publish this, is about 6% per egg. But really with minimal stimulation, at least if the patient is under 35, it's about 25% per egg. So it's just a dramatic difference because we're not ruining the egg with an overdose of FSH gonadotropin. And also we're making sure there's LH, which is responsible for egg quality. Now, many clinics, and we used to give microdose HCG for egg quality, but studies from Germany showed very clearly that LH is better than HCG for early embryo quality. That's just part of it. Another part of it, which is sort of obvious, is we always have to pre-treat with birth control pills. Anything that will kill off the developing follicles that would be overcooked if we started stimulating them just to get follicles so we can get the egg out of the ovary, because all those eggs are always being exposed to FSH and LH. So if we don't kill off those eggs that are already partly developing, then when we stimulate, we get a lot of bad quality eggs. So there are a number of principles involved in mini IVF, and it's just all related to the endocrinology of how the ovary really works, not just pounding the patient with huge doses and neglecting just the simplicity of it all. So that's basically the difference. It's easier on the patient, it's less expensive, but it's also more successful.
Okay, Dr. Silber, here is another couple questions. Well, first off, here's Megan's. Let's see. Megan's parents said this is Megan's parents in Florida. We thank God every day for Dr. Silber.
Oh my gosh!
And then also, here's another question for you. Do you have any recommendations to increase successful eggs retrieved? I'm scheduled for my second with you in April.
Oh, well, okay. So I don't want to reveal too much, but the most important thing is birth control pill suppression and low dose FSH and making sure that you have Clomid. Because you see, we can't give you LH exogenously because it's got a half-life of about an hour or hour and a half. And they tried to make it, but it never was successful. And so we can't even buy LH and we can't give it to you. But it's so easy to make sure you have good LH level if we just put you on Clomid and your pituitary stimulates you so that you make your own LH. Now, there's some women with what we call hypothalamic amenorrhea, and they're really not going to be able to make LH even with Clomid. So we have to give microdose HCG. But that's not really as good for the eggs as your own LH. So we'll do everything we can to get the best quality.
Okay, Dr. Silber, here's
Wait a second. I want to add something. I want to tell you that I've learned an awful lot in our new clinic from some new embryologists that are pretty amazing. And with a different, I should mention this, with a different approach to ICSI, injecting the sperm into the egg, I'm just amazed that the fertilization rate, we'd normally be happy with 72%, but now it's routine to have 82%. And in some cases, it's even over 90%, but that's a little bit wild. It won't be like that all the time. And we now have incubators that we don't change the culture condition when we open the door because there's separate individual micro incubators for each patient. So yeah, in terms of what we can do for your eggs now, there's been a big improvement since last time in the laboratory. It really is going to make a huge difference for egg quality. It's not just the stimulation, but it's how it's managed in the laboratory with this ultra new, I call it 22nd century equipment. So sorry, I wanted to give you that answer.
Sure. And Dr. Silber, so here would be your last question for this evening. I'm sure things have completely changed. Your team helped me 25 years ago. I'm curious what things are different.
Well, Deanna, that's kind of a repeat of what I was trying to say. First place, 25 years ago, we were not aware of the endocrinology of mini IVF. We learned that originally from Japanese colleagues in 2003. Then we actually changed it a bit, and I think we even improved it. So that's very important. But also, the equipment now is amazing. We can store the embryos in this machine called a Tomorrow machine, which my new embryologist brought to my attention. It's just amazing. It's so incredibly safe. It used to be that you'd be looking in what we call a dewar tank, and you'd be bending over to find the label, and it was always a little scary because you wanted to make sure you didn't pull anything out of the liquid nitrogen. And now it's just all in a machine, and you look at it, it reads your retina, you put in a password, you put in the patient's name and birth date, and lo and behold, a drawer opens up with her frozen embryo. So our storage is so much safer now than it used to be. But even what we have to store in tanks, like sperm and ovarian tissue, the tanks are so up to date. If the nitrogen is going down a little bit, you get warnings that maybe in 4 days you ought to check it, or check it before 4 days, and it goes to everybody's iPhone and everybody's iPad so that you're all warned about it. And now we have an AI system that I've watched our embryologists use that helps pick the right sperm. In other words, with your eyes, if it's all slowed down and the sperm aren't moving, you can really decide which are the best sperm. But if they're moving like this, like they usually are, it's a little difficult. But this AI points to what you ought to pick up and which sperm you should pick up. So the technology has gotten pretty spectacular in the last 25 years. So I guess that's it. We have no more time, but everybody look at Megan and her baby, and I'm not sure where her husband went, but there he is. The unsung hero, except Megan did sing his song and talked about how fantastic he has been. And look at that little 9-month-old girl. Incredible. So, okay, this is Dr. Silber for Infertility Center, St. Louis. You can always look us up on our website, or you can call anytime, and you can see patients. So you can call anytime and get a free consult on Zoom, anytime you want to call. So this is so great. You two are an inspiration to everyone. And so I'm Dr. Silber.
Thank you so much. We wouldn't be here without you. And I'm sorry she keeps talking over you, but she's very excited too. And she wanted to say thank you.
Oh, yes, absolutely. You can talk over me anytime. You're more interesting than any of us. Oh, what a sweetheart. And she loves her daddy. I can see that.
Yeah. Yeah, she loves daddy.
All right. So we got to get together, and I'm looking forward to an invitation to go trout fishing with you.
That sounds wonderful. We'll plan it. We'll get those trout.
I'll get the corn ready.
All right, sounds good. Thank you so much, Dr. Silber.
My pleasure. This has been a joy.
Bye.